Greetings from YogaKshema. Today, let us talk a little bit about a major problem we are all facing: false information. World Health Organization Director General Tedros Adhanom said, "We are not fighting an epidemic, we are fighting an infodemic." There is a barrage of information that is being sent on so many channels from so many sources that our mind is overwhelmed with data about one issue. We are willfully subjecting our minds to the assault of sensationalizing media. Processing information is a metabolic process that obviously consumes energy. And when we are subjected to cacophonous opinions and suggestions from everywhere, we can easily feel exhausted at the end of it all. We would lack energy for critical reasoning and decision making. Of course, many of these messages are actually forwarded to us by our own social circle, our relatives, friends, or acquaintances, who more often than not are well-intending and seek to help. How do we then filter out false information? Mike Caulfield from Washington State University has developed the SIFT methodology to weed out false information. Every letter in the word SIFT relates to an action for us to undertake. Simply stated, it is like this: stop, investigate the source, find better coverage, trace the claims, quotes, and media to original content. Before you forward anything, stop. Before you read a new bit of information on social media or WhatsApp and want to act on it, stop. Every time you want to react to opinions or video clips that are being shared, stop. When you want to share something that you received on WhatsApp, ask yourself if this is originating from a source that is credible or reliable. Has this been scientifically, medically validated? Is it true? Go online and look up the source of this information or details about what is being told in the information. It is also helpful to check the date on the news snippets being shared, or ensure that the images are not doctored using Photoshop or other tools. If an information is valid and true, there would be multiple sources that would cover that information. So look for other credible mentions, typically on reliable websites such as those that belong to the government or medical association. Trace the claims, quotes, and media to the original content. Many times, quotes, sayings, events will be reported out of context, or the full detail will not be provided. It is important that when you want to forward an information, you understand the whole context of what is being shared. Look for references. If claims don't have credible references that they can provide, treat them with caution and refrain from mindlessly spreading misinterpreted or fake medical news or tips. In an atmosphere already rattled with fear and confusion, let us not be the source of false information. As I sign off, let us ponder about how we can be more mindful in consuming and disseminating information, especially those that are medically related. As we are conquering the epidemic battle, can we conquer ourselves in the process? Take care, stay in, stay safe.